Now more than 13,517 monkeypox infections across the country that we know of, including at least 9 children. And Dr. Jen, as those confirmed monkeypox cases continue to go up, people are wondering what their risk level is, what types of activities are riskier than others, and how they can protect themselves. So we're hoping you can break this down for us. And we are going to start with what are the most risky behaviors?
Well, I think, first of all, big picture context here. Remember, this is an evolving medical situation, and we're going to continue to learn more about it. But here in the ABC Medical Unit, we put our heads together with Dr. Darian Sutton and Dr. John Brownstein and put together kind of an assessment, a spectrum, if you will, of risk stratification. So as you said, let's start with the most risky. These would be sexual encounters, which then, of course, usually involve prolonged skin-to-skin contact. Remember, this is not an STD per se, but most sexual encounters give you that time exposure that would be considered more risky.
Right, okay. And then the next category is just risky. So what's considered risky?
Yeah, so then moving down that spectrum, living with someone who is positive for monkeypox, contact with items used by someone positive with monkeypox. So that would be towels, sheets, bed linens, clothing, and then sharing cooking utensils, food, even potentially shaking hands. Again, if someone is actively infected with monkeypox, that then makes them and their contacts at a higher risk.
All right. Well, we've gotten used to not doing a lot of handshaking these days.
That's right.
Walk us through what's less risky.
Well, we've heard, again, all of the possibilities about the way this virus can spread. So less risky would be something like face-to-face contact with someone who has monkeypox, possibly because there is some spread by respiratory droplets. But again, that would have to be, pretty close face-to-face contact. And then any activities involving crowds. We've recently heard of some big festivals being canceled, unfortunately, because, again, there are a lot of crowds with people who may be then exposed.
Okay, but that's less risky. And then what is unlikely? What kind of activities are unlikely to spread monkeypox?
So I would put this at the lower end of the spectrum. And again, unlikely, low risk, but not zero risk would be brushing past someone who has a lesion or a blister, swimming in pools or using hot tubs or touching hard surfaces in public. Again, very, very unlikely. But as we learn more, that may change. Basic common sense precautions for those things apply. You want to keep your hands clean.